Hello, everybody. I'm Dr. Richard Lehman, and this is CORA podcast on Pediatric, CORA number 2. And with us today are Meghan Owens, Director of Pediatric Services for CORA from Virginia, Amanda Johnston, Early Intervention Specialist for CORA from Nashville, North Carolina, Ashley McFadden from the 314 St. Louis. And we're talking about pediatrics today, and this is a very, very germane topic, especially in this situation where we have everybody sheltering in place, etc. Also on board is Shane, also from the 314 St. Louis. Everybody welcome and thank you for joining. So we're going to get started, and the first question for Meghan Owens: what is CORA doing to support the pediatric population at the time, i.e., it's a unique time for kids and adults alike? What is going on? What is CORA doing to help and support that population?
So our clinics have remained open throughout this time. We are taking enhanced precautions, and all of our precautions can be seen on our website, coraphysicaltherapy.com. We also are offering telehealth sessions to anyone who is unable to attend in the clinic. We have different trainings on Monday, Wednesday, and Friday via Facebook Live. We have story time with CORA Kids as well, which is where a physical therapist, occupational therapist, or speech language pathologist reads a story and then demonstrates exercises and activities that your kids can practice doing at home to reinforce some of the principles that they're learning in therapy.
Anybody want to add anything to that? That was excellent. All right. So Amanda, what has been the biggest challenge in the face of the COVID virus and home quarantining in terms of pediatrics, kids, adolescents?
Well, in my area, we have gone to pretty much all telehealth. Approximately 90% of our patients are telehealth now. And the biggest thing was convincing the parents that they could do this because they would come back with a comment like, well, I'm not a therapist. I've not been trained. I don't know how to do this. And so just taking the time to speak with them and explain the hand placement and how to help their child and help them understand that they can do this and that they are the biggest advocate for their child.
And so you think functionally we can have good physical therapy, telehealth can really be beneficial in terms of pediatrics and treatment, physical therapy and treatment, and is it as effective or can it be as effective as physically going to the therapist?
I believe it can be. It takes a little bit of planning ahead to make sure the family has the things that you want to address. The great thing about telehealth is the flexibility, the scheduling. I can schedule virtually any time that's convenient for the child, for me. We can reschedule without having to worry about, in my caseload, I travel a lot, so I can't go to 2 different counties within the same morning. And so I can easily slip those kids back into the schedule and get a good quality session out of that. The other thing is it's teaching families how to play. A big part of doing pediatrics is play. It's play-based therapy. And so if the kid thinks they're playing, they're going to participate a lot better. And the families have to understand to think like that, to come up with activities that are meaningful and enjoyable while working towards that skill you're trying to get.
That was great. Thank you. So Ashley, how can telehealth benefit the pediatric population and in general, especially with the current situation? And maybe more importantly, can this be a long-term benefit? And Amanda touched on that a little bit. I wonder if you can expound on that a little bit.
Telehealth has definitely helped us to provide consistency with the kids' schedule right now. So we've been able to continuously progress their exercises, which we couldn't have done if they were not coming into the clinic. So the telehealth option has been able to allow us to consistently progress their programs. It's allowed us to keep them active during the quarantine and allow them more structure in their life during this time. And it is the one normalcy that they have during this unpredictable time, I think. I see this being very long-term as far as parents have really busy schedules. And so if we're able to keep up with telehealth after the quarantine, I think that maybe they could even get in more consistently, and we're able to see maybe some functional impairments that they have at home that they can demonstrate through telehealth that we maybe couldn't have seen in the clinic.
To bounce off of Amanda and Ashley, it also allows us to schedule during the times of day when the kids are struggling the most. So if they're struggling with feeding, it allows our occupational therapists or speech language pathologists to schedule the times when they're normally going to be eating. So around lunchtime or snack time. And it also allows us to really take a glimpse into their home and provide environmental modifications as needed as well.
That was great. That was really great. And I think very insightful. And along those lines, do you think there's a particular population, Megan, that you're most concerned about? I mean, who really concerns you? Which kids really concern you?
Our school kids who have multiple disabilities are probably most concerning to me because the families are so reliant on them to get PT, OT, and speech services in school. And right now, with schools being closed, those services either are not being administered or are being administered at a lower frequency. So one of the giant benefits, while we can't provide school-based services, we can bring them into the outpatient clinic or do evaluations via telehealth to get them additional services that they may require. Also, the kids who have a lot of equipment needs, they don't stop growing just because everything is on hold. So their equipment might need to be adjusted so they can continue to use that as well and prevent further orthopedic impairments in the future.
Thank you. Jane, tell us about the family structure, how do parents get involved, and how important are parents in this process?
Well, I think the parents are the biggest drivers of this to get everything scheduled. But it's the same as contacting CORA for their own appointment. It's contacting CORA, whether it's rapid referral or contacting their local clinic, or even contacting their same clinician who is coming out to their house for telehealth. So any of those ways, they can contact CORA to get an appointment, whether it's telehealth or in clinic, so that they don't lose anything.
And Amanda, finally, this is kind of really important. As we come out of this process, we kind of re-enter the atmosphere and the world opens back up. How important is physical therapy going to be moving forward as people start back to rehab, et cetera?
Important because if you think about it, we've all been cooped up in our houses for a while now. And so if I had to guess, the level of activity for all of us has greatly decreased. And so getting back into the clinic or even continuing with telehealth, however the future looks, I think it's going to be really important to get us all back to the new normal.
Thank you. Does anyone have any other thoughts? Is there anything anyone would like to add? Thoughts about telehealth, thoughts about CORA, thoughts about pediatrics?
I think the best thing that parents can do right now is to keep their children active, though. I mean, this, like I said, this is the one normal thing that they can do right now. And so performing their exercises consistently, encouraging them, and then making their exercises fun, which we specialize in. So we can help them with that component.
Maintaining consistent exercise is also very important. Our kids are dealing with a lot of big emotions right now, and exercise has been proven to be effective in helping reduce stress, which is so important when things are as unpredictable as they are at this time.
Everybody, thank you very much. This was excellent. I think the kids are our biggest resource right now, and we have to keep them healthy the best that we can. I think, like you said, looking into their environment is very important, and understanding their environment is very important. And again, I think we all need to pull in the same direction. So again, thank you very much. and you guys have a great weekend.